This is what we look for in a physical therapy aide or a PT aide or tech. Number one is we look for somebody who has a 4-year health science degree. So usually this is kinesiology, exercise science, something along those lines, perhaps a biology degree. And the key is that they're usually looking for a position for a year to get some experience in an outpatient PT clinic, and they're looking to go back and get their DPT, their doctorate in physical therapy. So most of the aides that we've had who have come through, they're with us for a year, sometimes 2 years, as they're applying to different PT universities, and they gain valuable experience with us during that time. So I'll be the first to tell you this is not a high-paying job by any means. It is the pay stinks, as I usually say during the interview, but it is fantastic at getting experience with. We have some world-class physical therapists here, and you get to see that process, and it will help you tremendously as you're going back to school and you're learning physical therapy techniques that you have a couple thousand hours of amazing paid-for experience. Most therapists, as I had alluded to, they take a year or two off in between their undergraduate school and getting their degree there, and then going back and getting a more advanced master's or doctorate degree. They are also always interested in outpatient orthopedics. So we've had aides go back to school to become DOs, nurses, radiologists, radiology techs, oncology techs, so, occupational therapists, and then physical therapists in other settings other than outpatient orthopedics, but they've all come in at least with an interest in outpatient orthopedics. At the same time, we've really have had very little trouble at all with our aides, just in using that selection criteria, that they have a goal of one day getting their DPT or another advanced degree. This is full-time work. It's 40 hours a week. All of our aides work on a team, so we just use the Pennsylvania State Practice Act, so it's a PT, a PTA, and an aide on each team. The PT does what the PTA licensed, the licensed PTA cannot do, and also what the tech or the PT aide cannot do, and that is assessment, evaluation or examination, assessment, and then also the hands-on physical therapy that we provide to almost every single patient who comes through. We do work in teams, so the same patient works with the same team every time they come in for each and every visit. So along those same lines, it's our aides are not switching teams or anything like that. They're not floating around the clinic. They're working with the same physical therapist and the same PTA in the same area every single day when they come to work. So all of our teams work out pretty well together. They're social, and everything works. I will say the workload that is left for the aide, or that the aides take responsibility for, are there's a little bit of grunt work in there. So it's wiping down tables after every patient. It's getting weights. It's getting ankle weights. It's cutting TheraBand for patients to take home. It's grabbing exercise cards and exercise instructions. It's bringing the patient back from the waiting room and taking them back out. It's also doing laundry. And so if that's something that you're interested in and you're willing to do in a very high-toned way and fun way, then fantastic, then we can talk. But that's what we look for in a physical therapy aide. We also do a working interview where we see, we're looking for a work ethic. So, how good is somebody at completing their tasks? Do they get lost easily? Are we looking for them? Which we've had happen 1 or 2 times, and we just had to let that aide go. But for the most part, 95% of the time, our aides have worked out extremely, extremely well, and have been a productive part of our clinic. And we've had quite a few go on and get their DPTs, or, like I said, other advanced degrees. And we were just a unique stepping stone along the way. So that's what we're looking for. If you are interested in the position, and we have 2 openings as of right now, 2 full-time positions, you can email your resume to me here, chad.madden@maddenpt.com, or to our clinic director would be joe.hribick, HRIBICK, at maddenpt.com. Thank you.